at it going now. So for the benefit of the people being recorded, watching the recording as well, it's a Friday afternoon. It's just before the Easter holidays and it's sunny. So we are assuming that the people that have chosen to attend so far are A, really, really keen, and B, would like us to crack on with it so they can get out in the sunshine as well. So you know me, and I'd just like to introduce you to Connor Jeffries. And this is the second time, I think, that Connor's done this session for us. And Connor is a counselling psychology trainee, now in his final year. And the reason that we've organised this is to give you some insight into some alternative ways to enter the world of applied psychology. And counselling psychology has got a different way to get into it. It's got different funding streams. It has a different emphasis. So this might be something that people are interested in considering as they are leaving the University of Manchester. And the University of Manchester does do this degree. Obviously, that's where we've got Connor from. So if you want any more information, you can go on the website and you can then find out more about the programme. And I would encourage you to get in touch with any contact names on that programme as well. But I know in the past, Connor's been kind enough to speak to people that have been considering this. So he may relent as well this time. So Connor, over to you. You have control of the slides.
Thank you, thank you. So yeah, thank you for the introduction. So I wanted to talk about counselling psychology, obviously because this is what I'm doing, but also I do recognise that for people interested in becoming a psychologist, working therapeutically, clinically, or even just in terms of research or teaching, clinical psychology is the route that everyone knows about. And of course, it's funded, which is just fantastic, but it sounds like an absolute nightmare to get on. It sounds really competitive. So not just for that reason, but also for the fact that we want to just kind of share what else is available in terms of applied psychology. When we say applied psychology, we mean branches of psychology that involve, therapeutic practice, at least, I think. So I think counseling psychology is a fantastic alternative to clinical psychology. They're both great. They're both becoming increasingly similar to one another in terms of scope, in terms of qualification, and in terms of the job opportunities that you get. So I'm hoping that the slides will change. So, okay, so I thought I'd start by talking about my journey to counselling psychology. So it was actually when I was around where kind of the stage of education that you guys are at. And I think I was in my second year, or I think it might have even been my final year of my bachelor's in psychology. So I was quite late in the game, but it was still fine. And I kind of thought, don't know if it's because I'd had personal therapy at university, and I was like, oh, this is interesting. And then, of course, like many of us who are interested in these kinds of jobs, we all have our own stuff going on, or people that we know who have got psychological distress, and so you do have that personal interest. And a part of me was thinking, oh God, I can't become a therapist because I've got mental health stuff going on. A lot of people think and say that, and it's further from the truth. A lot of us think that to have those experiences is really helpful in being able to empathize and, understand the experiences of the people we work with therapeutically. So I don't want anyone to be afraid of or worried about, oh, I've got shit going on, I can't be a psychologist. I'd actively encourage you to think about it anyway. So it was at that time that I thought, right, I want to become I actually wanted to be a CBT therapist. And then I went to a careers talk, and the guy mentioned counseling psychology as an alternative, and I kind of read up about it. And it just ticked all my boxes in terms of the way that it works, the values, the ethos, the therapeutic approaches. It was very similar to clinical psychology. And so I just started to work my way towards that. I did some voluntary work. I think I was, what was I? I was a community wellbeing volunteer, which involved just kind of chatting to people who were feeling low and whatnot in the community. Didn't get paid for it, obviously, but it was just really good experience for having, I don't know if therapeutic is the right word, but kind of relationships with people and just helping them to feel heard and listened to and help them in whatever way you can. I think I went on to become a crisis recovery worker. At the same time, I was like working at Tesco. I was like doing my bachelor's, and then I moved on to crisis recovery worker was great as well because you're working with people in distress in terms of like suicidal thoughts and self-harm and stuff. So that was good exposure in terms of risk and safeguarding. And I then went on to train as a psychological wellbeing practitioner, which I imagine a lot of you have heard about. So I went bang on about that. But that I trained in for a year and qualified in and worked there for a year. And that set me up beautifully for the counselling psychology course. And I know that you guys, many of you guys might be considering becoming an applied psychologist, which is, I think maybe, I think being a psychological wellbeing practitioner helps to become an assistant psychologist. Maybe it's the other way around, I can't remember. But all of those experiences are just great in terms of becoming in terms of, you know, getting yourself prepared for a doctorate in applied psychology. The other thing I was thinking was that introduction to counselling skills was really helpful. And in some courses, especially the one at Manchester, they do advise that we have an introductory course in counselling skills, so that we've got that kind of underpinning before we get onto the course. But yeah, so I kind of went through my first year at the University of Manchester. I should say the reason that I'm on this course, and I know a lot of you will be thinking, well, how, you know, how on earth do I get onto a course that's self-funded? It is a huge issue, and it does create a lot of inequities in terms of people are able to access it, for instance, in terms of social class. So I do want to name that. The reason that I'm on the course is because I managed to get a scholarship. So the University of Manchester is one of the few program providers in the UK that offer scholarships, and I'll talk a little bit about that in a moment. But yeah, in the first year of training, we practiced in humanistic counselling psychology, so looking at person-centered therapy, experiential approaches to therapy, and that involved working on placement in using person-centered counselling psychology. And then second year was cognitive behavioral counselling psychology, and third wave approaches. So, you know, if you think that CBT is second wave, first wave is behaviorism, I think. Second wave is CBT. Third wave is like usually I think the combination of CBT and mindfulness. So things like compassion focused therapy and cognitive analytic therapy, or ACT, acceptance and commitment therapy. But I did that in my second year. And then third year, we looked at pluralistic approaches to counseling psychology. So thinking about what are the client's goals, what do I have in my toolkit that I can use to work with them outside of a kind of prescriptive model. So rather than just kind of using a singular model, a pluralistic approach involves kind of drawing on different skills or techniques or theory to help that unique person recognizing their uniqueness and recognizing that maybe a model of therapy, if applied prescriptively, wouldn't necessarily be so helpful. So counseling psychology, I was really drawn to that because of that kind of pluralistic approach. I mean, it's not perfect, like any model of therapy, it's not perfect, but it drew me. And then yeah, I'm in my third year, and there's a thesis as well. Which I think is quite similar to what you guys would have on the clin psych. I don't know. I think it might be structured differently, but yeah, there is a written kind of research project that you have as well. So yeah, I'm really enjoying it to be honest, and I'm quite close, hopefully, to finishing the course. And then yeah, I'll be applying for the jobs that clinical psychologists apply for, and counselling psychologists apply for. And there's lots of different places that counselling psychologists can work, including the NHS, forensic settings like the police services, um, what I said, NHS, forensic settings, educational settings like at university counselling services or in schools, inpatient settings, and just lots of different places really. So it is quite similar to clinical psychology is what I'm trying to throw at you. Um, okay, how do I get onto the next slide? Okay, so what is counselling psychology? Ooh. So defining counseling psychology is a branch of applied professional psychology. It sits alongside clinical psychology, but its origins in the UK are within the humanistic movement. So that's very much seeing the individual as unique and relating, working with them in a relational way, and thinking about the ways in which they might be able to reach their goals as a human being. That's a really rubbish definition, but it's also influenced by the science of psychology. So it does draw on cognitive, developmental, and social approaches. So it's combining the two, humanism and scientific or empirical psychology. Um, okay, so where does counseling psychology fit alongside things like clinical psychology? So, yeah, counseling psychology is a branch of applied psychology that sits alongside clinical, forensic, organizational, and educational psychology. So because they're all branches of applied psychology, we can expect that they have some similarities in the way that they work. And that includes the competencies that we're expected to have. So both clinical and counselling psychologists are regulated by the Health and Care Professions Council, which is a regulating body for counselling and clinical psychologists. And they have competencies, ethics, and other stuff, standards of competencies that we're supposed to demonstrate that we're, so for instance, demonstrating the competency of confidentiality, knowing what that is, what its limits are, the competency of knowing what a dual relationship is, not working with a client who's your best mate. It's also similar to clinical psychology in terms of therapeutic modality. So obviously both clinical psych and counseling psych use cognitive behavioral therapy amongst other approaches. Client groups, as I've said, we might both be working in forensic, inpatient, educational, NHS setting, and we both use an evidence-based approach to practice. So, we're looking at the research, we're thinking about, okay, for this particular client, what approach might best fit their needs. I think nowadays we refer to it as a research informed approach. So rather than being drawn just by the research, we're also thinking about what therapeutic approach would work for the client based on what we know about the client themselves. So we're combining our knowledge about the client and we're thinking about the evidence base, combining the two to think about what therapy will be most helpful. So very similar to, very fancy. I can't remember doing that. Um, so very similar to clinical psychology, I do want to emphasize. In terms of its aims, then, counseling psychology aims to alleviate psychological distress and to facilitate psychological well-being. So this is very much a humanistic kind of way of thinking. It's not just about removing a problem. Like you think of like in the medical model, if you've got a doctor and you've told your doctor that you've got a verruca, I don't know, your doctor thinking, right, what treatment can we do to remove the problem? In counseling psychology and also in clinical psychology, we're thinking about what we can do. Yes, we want to alleviate distress, but we also want to think, we don't want to leave it there. We want to think about how to improve their well-being. And the emphasis is on the therapeutic relationship. So rather than seeing the therapist or the counseling or the psychologist as an expert, it's very much an egalitarian relationship. We're both on the same, recognizing, of course, that the psychologist will have power, they get paid, they know the therapies and they could exploit that relationship if they wanted to. So recognizing that power, the idea is that we work together on an equal playing field. Um, so very egalitarian in that sense. Yeah, so we're looking at contrasting the medical model, the idea that a problem can be fixed. So if someone had low mood, then we just throw them sertraline because that will treat the biological component. We're looking at kind of challenging the idea of diagnosis can be helpful, but we're kind of trying to step a little bit away from just using diagnosis. Instead, seeing the human being as seeing them more holistically. So yes, they might have kind of biological and genetic predispositions to certain experiences of psychological distress. But what are the influences of the environment on their distress? Are they in a stressful relationship? Are they what are the impacts of politics on what are the impacts of socio-cultural or socioeconomic background on their experiences? So we're trying to kind of see it less as, okay, the client's the problem, the client has depression, is depressed, and needs sertraline, that'll fix it. We're kind of recognizing that there's a world existing around that individual, politically, socially, economically, also in terms of the identity politics, in terms of being minoritized, in terms of racialized identity, for instance, or by gender. So we're seeing the human being very much in a holistic way rather than just thinking of the medical model. And I've just tried to slay the medical model there. So disempowering, stigmatizing, and psychological distress is subjective. We all might experience low mood, but how that shows up for each of us will be quite different. So yeah, labels, for instance, of depression or borderline personality disorder just reflect the discourse that's being, the ways that language is used in today's society right now in this particular place. And we've seen over the last 50 or so years that language changes to reflect, diagnoses change because ideas change. There was one point where I think being gay um, a mental illness, and they've changed the language around borderline personality disorder to emotionally unstable personality disorder. Ideas about what reflects psychological distress changes. So that's why we're just emphasizing here that it's subjective. Okay, so I guess before I feel like I'm rushing through this, but from what I've said so far, is there any questions around the identity of counseling psychology, um, what it means, what it looks like, how it might be similar to or different from psych? Any questions at all before I just ramble on? No? Cool. Anything from you, Lou?
Yeah, just the introduction to the introductory skills for counselling. I think this might have come up. So you said that that was one of the things that they might recommend that you do. Would that possibly be the sort of course that people should be looking out for, perhaps postgraduate in thinking about what could help me get onto various different. So it would both be um, it would both be. Sorry, I've just seen Alicia's question. It's completely backfooted me. No, because it's not a good question, Alicia. Sorry. Um, oh yeah, both because you might actually want to go on to pursue a career in counselling without doing the doctorate, which you can do. There are the
Absolutely.
routes into being a counsellor. You don't
Yes.
get a doctorate from them, but also as potentially as a pre-course to clinical or to counselling psychology. So that's got cost implications, I'm assuming, as well. Can you remember how long it took you or anything like that?
Mine, I think, was 6 weeks. It was a level two, which is the equivalent of GCSE. I did this in my final year of my undergrad in psychology. It cost, oh God, I can't remember. I think it might have been between £100 and £200. Um, yeah, I mean, ultimately, what's frustrating about this, hence the sigh, I think, is it's almost like ticking a box to get onto a doctorate.
Mhm.
However, I do really appreciate and agree with what you said there about. I think the idea might be that jumping into a doctorate in clinical or counseling psychologist without exposure to, for instance, basic counseling skills, you might not know what to expect. And just an introductory counseling skills course could really show you actually, this isn't for me. Or it might show you, oh, wow, this is great. Or actually, I just want to be a counselor. I don't really care about being a psychologist. This is perfect. So
Mm.
it's just dipping your toes in really before you jump in to the doctorate. But yes, I do recognize there are financial implications.
Yeah,
Um,
it's not a huge investment compared to some other things. So
no.
I'm thinking, shall I go on and do a master's course, for example, or something like that?
Mm,
It's slightly
you
different
really
kind
don't
of
need a master's. I
mm.
know that some people feel that no, okay, so this is in some ways what makes counseling different from clinical, which is obviously a huge question. But I think well, I've just lost my train of thought actually.
Talking about masters and whether they're required.
Yeah, so I've that's part of my interviews with my participants for my research study, which is looking at the experience of pursuing a counseling psychology doctorate for people from working class backgrounds. And some of the participants felt that they had to do a master's to kind of set themselves apart from others. In clinical psychology, I can absolutely understand why the level of competition means that we feel like we have to do more and more and more. I will be honest, in counseling psychology, that definitely isn't needed. People in my year group didn't have, I don't mean this in a braggy way, but they didn't have half the experience that I had, and they got on and they're amazing at what they do. People have had like basic experience, haven't been a therapist before, and they've got onto this course. Um, so yeah, I think they say that the Introduction to Counseling Skills course is good because it exposes you, but by no means do you have to do a master's in CBT or anything like
Yeah, okay. Should we move on to Alicia's question then? Because it's a big question.
that.
So
Mm.
Alicia, just in case you or people watching this haven't been to earlier clinical psychology club meetings, the clinical psychology doctorate is a paid route into applied psychology. So that which is probably the main reason it's so competitive, actually.
Hmm.
So basically, it's a 3-year doctorate which the NHS pay you to do, and it's paid. I don't know if it's the same body now, but it was Health Education England will pay you to do that doctorate. So you're paid, just to put things in context, as an assistant psychologist, you usually on around about a band 4 or band 5. As a qualified nurse, you qualify onto a band 5. So as an assistant psychologist, you can earn more or less what a qualified nurse earns. When you train to be a clinical psychologist, you train on a band 6 NHS grade. And that basically means that you're training on so you're actually a student, if you like, on a grade that's higher than a newly qualified nurse and is more like a kind of senior sister on a ward. You then graduate onto a band 7, which is the equivalent to a team manager or a ward manager. So really quite senior in the world of management and nursing and physiotherapy and occupational therapy. So remuneration wise, clinical psychology is immediately a better bet for you because you don't have to pay for 3 years of funding for yourself. So you don't pay fees, you get paid a wage, so you can pay your own rent or mortgage, you can buy a car, all of those things. However, in counselling psychology, that isn't the case. But as a counselling psychologist, when you graduate, you would go on to the same grade as a clinical psychologist graduating. So you would go straight on to a band 7 there. So that's one of the differences. Connie, you can help me out with this one. Another one of the differences is about work time and commitment. So on the clinical psychology degree, doctorate, because you are working full time for the NHS, everything is done within that time, and you don't, it's not term time. So you'll get NHS holidays, which is about 28 days a year, start off, and your bank holidays. Connor, tell me what it's like for counselling.
Think because we're not funded by the NHS, it means that we select rather than, I mean, you can select placements as a clinical psych trainee, can't you? But is within certain, there's like it's rotation, isn't it? So
In
there's
your
certain.
3rd year, more or less,
Oh,
yeah.
right, okay. Whereas in counseling psychology, we have a little bit more flexibility in terms of, well, we're like competing for um our own doctorate. But we can choose which placements to go on to. So for in year one at this doctorate, you can choose any placement that facilitates humanistic counseling psychology practice, person-centered therapy. Second year, any placement that does CBT. Third year, as Lou said, for ClinPsych, any placement you like. So there's flexibility in terms of choice. But of course, you're not getting paid. Well, I'll come back to that. And the other thing is that, yeah, you have more flexibility in terms of time of work. You can even work later in the day. I think one of my friends starts placement in the afternoon, finishes in the evening. So there's a little bit more flexibility, maybe. And
Do
you
you
do get,
do you
go
have
on.
semesters?
We have teaching, yes, 2 semesters, 10 weeks of teaching, and it'll be like 2 or 3 days a week of teaching in year 1 and 2, 3 days of teaching, and the other 2 days are placement. The other thing as well is that we're accumulating a total of 450 therapeutic hours across the year, across the 3 years. So that includes individual, family, group, and possibly couples therapy practice. But once you start accumulating your hours and you get to maybe 300 hours, for your final year placement, it's quite common to get a paid placement if if you apply for one at the usual places like NHS jobs and stuff. So it is possible to get a paid placement later on in the course. You may also find that you work somewhere where you could use that as a paid placement. But I do appreciate that just is a bit more effort than a clin psych where you just get paid.
Yeah.
But there are options to be paid.
And do the courses help you find those placements?
They have a lot of contacts in terms of placements that are available. We're also able to set up new placements, and the course will support us to do that. The course, I've asked them to be more transparent about which placements are paid. But I think there's an idea that if we just tell everyone it's paid, then they'll all go to that one, and they might not yet have the skills to warrant being paid. So it's a bit difficult on that. But in third year, you just apply online, I think, for different jobs. But I mean, if you go on, one of my friends worked at an inpatient setting in year two, and she was offered within that organization a paid job for year three, so she stayed there. So you might find that if you that the placement you're on offers you to stay on and pays you. So
Right.
um,
Okay. And they can be any organization, can't they?
yeah, I think so.
Doesn't have to
Yeah.
be NHS.
No, no, no. This one's what's it called? The Priory,
Oh yeah,
which
yeah, yeah.
is where I work now, but I can't remember what type of thing you'd call that. Inpatient, I don't know.
I think they dabble in all sorts, don't they, the primary.
Yeah. Independent healthcare. Yeah.
So do you because this will be another difference just to keep with your question, Alicia. Do you have therefore summer breaks and Christmas breaks rather than have 28 days holiday that you have to take?
Yeah, so I can go home. Like, I'll be going home for a couple of weeks over Easter. I'll be going home for Christmas, for a couple of weeks. Like, you don't really have annual leave because you're not getting paid, so you can kind
Yeah,
of do what you want. But you're just having to think about, I wouldn't have to be at placement. I could choose to have loads of annual leave. I mean, they'd probably look at me and think, why are you here? But your own agenda is thinking, I need to get 450 therapy hours, so I want to be there. But they do on the course really strongly recommend taking leave. I think, I guess the point you're trying to make, and that I'm not really supporting very well, is that yeah, it's very flexible on annual leave. You just ask for it and you get it. They would never turn it down unless you ask for it
yeah.
for like the
So,
following.
so I suppose what I'm getting at is that over the summer when there's not teaching, that's you're much more flexible. You can
Mm.
you could put 4 weeks of permanent therapy work in and then do something else or
Yes,
yeah,
yeah. So you usually do two days during term time, during teaching time, two days of placement, 1 to 2 days of placement, and then yeah, when it's no weeks of no teaching, you can go up to 3 days, possibly 4 days of placement. Just recognizing, of course, that you've also got your thesis work to do as well. So yeah, there's flexibility in terms of increasing your placement hours during non-term time.
right,
Um,
okay. Have you known of anyone on your degree program that's had problems getting placements? Because that's the only thing for me that would apart I mean take putting aside the money that it takes obviously
mm.
to see yourself through it. I think I would be anxious about finding a placement, not knowing the territory, if you like, not knowing what might be available, and then having to find one. Have you come across anybody that's had any difficulties?
This course is fantastic. On the SharePoint, 'cause everything's moved to SharePoint, isn't it? They have a folder dedicated to placements that have been set up by the university. They have each of them has a document that specifies everything you could possibly need. Where is it? What is it? What therapy are you going to use? How many client hours can you do? Can I record my CBT recording here because you need to do that for an assignment? What opportunities could I get here? How do I contact this person? What year groups would they recommend us doing this placement on? Some only want second years and third years to do it. They've got a
Yeah,
bit more experience. So the information is really on it. They're really on it with the information. So no one, I'm not aware of anyone that struggled with getting a placement. Yes, you have to interview, and some places might say you're not quite ready, like maybe come back in 6 months or a year, but they will be very likely to take you on then. I don't know anyone that struggled with getting a placement. We might just struggle with getting a placement that we want.
yeah.
You know what I mean?
Yeah, yeah. And I mean, on the clinical doctorate now, for probably people on the call won't be aware of this, but because the number of places has been increased so greatly now, it's like 50 trainees per intake, I think now, that they're really struggling for placements actually for clinical psychology. So some students haven't been able to get their full gamut of experience. So it used to be that you would have child and adult placements in your first year, and then you would have older adult and learning disability placements in your second year. And then most courses in your third year, you get to choose what it is that you do. But actually that it's become so pressured for places that some people are spending almost the whole of their second year in one service. but trying to meet the competencies they would have got in other services through that one service. So to give you an example, in learning disability services and in older adult services, we'll quite often use psychological testing to understand where somebody's psychological cognitive functioning is. So their memory, their spatial awareness, their just trying to think of the frontal skills, executive functioning skills, all of those sorts of things, and for different reasons. So in older adults, it's usually to compare with what they would have performed as before, and it's a sort of dementia screen. In learning disability services, it's to find out how people are functioning, because we need to know what level they're working at in order to develop plans for them. But the actual tests that are used are pretty much the same across those services. So it might be that you might have a whole year of working with learning disability, but you would cover some of the competencies like neuropsychological testing with older people. So yeah, so that's just a bit of an aside that I guess it might even be that you get more choice of placement thinking about doing the counselling psychology, because there are non-NHS placements and different kinds of requirements for those placements.
And then I guess there's the caveat of, I think in counseling psychology, we're not as on it with neuropsychological testing. I don't have any experience. Well, I've got basic experience with psychometric testing for like psychological distress, but not for learning difficulties and not for like specific groups like older adults. So, in terms of I can't remember the word you said, neuro, what's this? We don't really look at that in much depth, which I think is a flaw of our programs at the moment. So
yeah, I mean that's interesting. So the programs will have different competencies. So Connor was saying that it might be one of the similarities with clinical is true that both programs will have a set of competencies, but for clinical psychology, one of the competencies has to be neuropsychological testing. So it might be that as a counselling psychology trainee, you've got a real interest in that. And I know when I was training as a clinical psychologist up in the Northeast, one of my trainee colleagues was a counselling psychology trainee who had gone out of her way to get experience doing a lot of neuropsychological testing because she was really interested in that. So it's not that you can't cover the same things. It's just the course might not require you to cover those things. But you could still potentially choose to cover them and go and go, because basically you're a free pair of hands to an NHS service as well. If you're a competent person, then they'd be probably quite happy to take you on. And so with Kate arranging her own placements, that's what she did, was she wooed people with her freeness, really, and has worked actually for that service ever since. So it's quite interesting.
Yeah. And a few of my friends at the moment are thinking about getting training to do neuropsychological testing and ADHD screening and stuff like that. So the possibilities for learning certain things are there around the course. So
yeah.
yeah.
The other question that I had that people watching might not be aware might be a thing, but you were saying that the thesis might be the same. So people who've come to the Clinical Psychology Club before will know that the doctorate in clinical psychology has got three parts to it. So it's basically a knowledge component, a clinical practical component, and a research component, and they are weighted equally, basically. So you have to pass all three in order to graduate. The clinical psychology doctorate at Manchester requires, in the research bit, for you to do 3 papers. One of them is a systematic review. One of them is an empirical paper, so a piece of original research. And then one of them is a reflective paper, which is different to when I did my doctorate. And I know some doctorate courses are still doing it like me. It's just like a PhD thesis. Mine was like 50,000 words, one study, basically. So I'm just wondering, when you were saying that it's similar, what are the requirements in terms of research for the counselling psychology doctorate?
Oh yeah, I think whilst maybe I said they're similar, yeah, I think there are quite a few differences. So the thesis, and this might just be at this particular university, because this is a research heavy place. It's a, what do you call it, a Russell group. So it's really interested in research. So we do 50,000 word theses on a topic that we like, but at this university it has to fit in within one of the 3 themes of the School of Education, which is what we're part of. So I think it has to relate to education and therapy, So maybe, therapy in schools or higher education. Can't remember what the second one is, and psychology, inequality, and education. So usually it's about psychology or therapy and education. There has to be a kind of link made in your topic between the two. So hence mine is about working class trainee psychology doctorate students. So
Yeah.
it's there. But then outside of that, you can kind of look at what you want. So my friend's looking at the experiences of student mothers. Someone else is looking at the experiences of Black trainee counselling psychologists, recognizing that they are so few. I can't remember. Some people are looking at AI, which sounds really interesting. Trying to think that there's lots of diversity in terms of what you're able to look at for a thesis. But yeah, the thesis is structured by a chapter on an introduction chapter, a methodology, sorry, an introduction, literature review, methodology, findings or result, discussion. So 5 chapters, all coming together to around 50,000 words. But then outside of that, we do have reflexive papers, two reflexivity papers that kind of allow us to explore our motivations for becoming a psychologist, our reflections on our areas of practice and how we use models of therapy, at the relationship between the personal and the professional in terms of, what we're like outside of the profession and what we're like in the profession and how they might be similar or not. So yeah, just really reflect. And so we've got reflexive papers, then we've got a systematic review, a theoretical paper that we can choose the topic of, and we write a research proposal. There's quite a few different papers that we do write during the course, and there's that big thesis as well. It's a lot of work, but I think, it sounds like whatever the program is, it might just organize the competencies in different ways. So one program will try to meet all of the competencies using maybe 3 assignments. We might do it using 5, but we don't have to do something else. So it'll just be differently weighted, I guess. I don't know what I'm trying to say. You'll all get the same stuff done and it'll all be the same amount of work, but it's just organized slightly differently.
Yeah. Yeah,
Uh,
which is an important point to make, that we're both talking about University of Manchester at the minute. So
mm,
different doctoral courses are going to have different. So anyone thinking of doing either of these sort of routes to applied psychology should really look at handbooks and find out
yes.
what they're saying. So, for example, there are different modalities of therapy that the clinical psychology doctorates prefer. Because at
Mm,
one point the BPS, I think, said to them, you need to have grounding in 3 areas. So when I was at Newcastle, they chose neuropsychology, systemic therapy, and CBT, and
mm,
which pissed off everybody in psychodynamic psychotherapy. And there was
mhm,
an actual, walking out of teaching. People said, "Well, we're not going to teach on it then. If this isn't thought to be a clear competency for the trainees, we're not interested."
mm,
That's all been resolved. But and I think at Manchester, I'm not sure what Manchester is, but it's, you have to have those kind of 3 areas. So they are set up quite differently, actually. But
mm.
as I think, given that the end result for any of the trainees is a band 7 post in the NHS or private practice, in the end, you kind of get to the same place. It's that. Actually, Connor,
I,
here's the question that
I
I
kind
hadn't
of
heard.
wanted to ask about that
Oh,
actually, because
yeah.
I probably should have checked career stuff earlier, but I've only started doing this quite recently. But so counseling psychology and clinical psychology, you end up with similar jobs within the NHS, because I was looking at jobs in the NHS and they all have the exact same name with like 1 letter difference. So this would go into being a therapist or an assistant therapist, or
So being an assistant psychologist is
assistant.
pre-qual. So you wouldn't be
Okay.
qualified at that point. So that would be the sort of post that you can take on after you get your undergraduate degree.
Okay.
Yeah, and it's really helpful to get one to get onto the doctorate in clinical psychology, because it means that you know a lot about clinical psychology before you have to be interviewed and so on. So it makes you very competitive.
Right.
Um, the when you graduate either as a clinical psychologist or a counselling psychologist, most
Yeah.
NHS trusts now will ask you to have to be an applied psychologist, no, a practicing
Practitioner.
what's it called? Practitioner. Thanks, Connor. Practitioner psychologist, and that covers counselling and clinical. It used to be only clinical psychologists, and then some trusts said, oh well, we'll let counselling psychologists in as well because we haven't got enough clinical psychologists, and actually the counselling ones we've got are good. And then when Healthcare Professions Council kind of took on the governance of our profession, they have called us all practitioner psychologists. So that's the label that we get then. So if you come across assistant psychology posts, that's pre-qualification.
Okay, thank you. It's very confusing.
It is very
There's lots of
confusing.
terms, isn't there?
Yeah, it's very confusing. And I would recommend that you kind of, if you have a look on the Blackboard site for the Clinical Psychology Club, there's quite a few podcasts on there, but also there's just the odd folder that's got things in, like the Psychological Professions Network, which is have you found that? It's like a website that tells you about all the different jobs that you could consider as a therapist.
I think I had a look at that. Yeah.
So because we've talked a little bit about psychological wellbeing practitioners, and they're different to CBT therapists, and they're different to counselling psychologists, and that it's only got more confusing over time, not less confusing, unfortunately.
Yeah. There's when I was looking up counselling psychology, the website prospects.ac.uk had a really good, I don't know if anyone's come across this, a really good summary of an overview of what a counselling psychologist does in terms of practice and whatnot, but also what entry requirements they need, what skills you develop, what knowledge you develop, what salary you'd get, what jobs you could go into, what careers you could go into. So that was really helpful, just to kind of lay out what's needed really at those different stages. But yeah, I think, practitioner psychologist is something that underpins that covers clin psych, counselling psychology. Is there anything else like educational psychologist, or is it just
no, I don't think so. I think they've got one.
And so like when you look for a job on the NHS, you'll often see now that it will say clinical or counselling psychologist, and counselling psychologists can, bizarrely enough, also apply for a post that just says clinical psychologist. It's very confusing. And you know what? I find all the AP, PWP, CWP, all of these, it's crazy, isn't it? But in some ways, yes, it is hard to get your head around, but it is nice that there is some kind of flexibility and variety in how we can get there.
Yeah, that's the flip side of it, is there are more posts now for learning how to be a psychological profession in the psychological professions than there ever have been before. So it's confusing, but it's, it's kind of, it has opened things up a little bit, I think.
Thank you.
Any other questions from anybody about the... Okay.
What therapies do we learn in counselling psychology doctorate? So I think Lou was kind of leading to this in that the different program provided in the UK will offer different therapies, and they're really clear about we're not training as, so for instance, in here at Manchester, it's the first year is person-centered counselling psychology, the second year is cognitive behavioural counselling psychology. All counselling psychology doctorates also look at a pluralistic approach to therapy, which I definitely encourage you to look at. There's a book written by Mick Cooper and John McLeod, MCLEOD, and they talk about their approach to a pluralistic approach. It's this idea that, we're just looking at the individual and we'll kind of draw on different things for this particular person. But as Lou said, like different program providers will offer different therapeutic approaches. So I know that other universities I actively avoided because it had approaches that I wasn't interested in. And I went for this one because I thought I really want to learn person-centered. I really want to learn CBT. And so I definitely see this as like an opportunity to shop around for the particular doctorate program that you want to get skills and knowledge out of. And it's not just in terms of therapy as well, like different program providers also have different research expertise. So our program has lots of really skilled, really well-known researchers in the field of counselling psychology and social justice and things like that. Whereas at, for instance, University of York, St. John's, Divine is really well known for his research, and they're just different areas of research. So if you want to do your thesis on something in education, then this is great. I don't know what Divine's research, and I don't know what York's research in general looks like, but I think this is just an opportunity to see, counselling psychology is a huge, broad branch, but there's so much variety that you can really shop for what you want to connect with. And so look across the different courses. But they are really clear as well that we're not learning CBT, we're not learning person-centered therapy or counselling, we're learning person-centered counselling psychology, we're learning cognitive behavioral counselling psychology. And that's just a view of we're not actually training as CBT therapists or counsellors. We're kind of a little bit, it's slightly different. We're using the approaches, but we're kind of also drawing on counselling psychology, philosophy, and values. So we'll be under everything we do, even CBT, will be underpinned by a humanistic value base. So seeing all of these things on this slide, really, seeing the individual as unique, working with them relationally, having an egalitarian, non-hierarchical relationship. So it's underpinned by all of these values, even though it will still be using stuff from CBT, for instance. I hope that makes sense. So even CAT, compassion-focused counselling psychology, cognitive analytically focused counselling psychology. So yeah, really shop, and also the placements on the program offer, at this program at least, offer different, you want to shop on the course for different placements that use therapeutic approaches that you're interested in. Some will offer schema therapy, some will offer CAT, some will offer compassion, etc. So really think about which ones you're interested in learning and go for those. So yeah, lots of variety.
Counselling jobs in the NHS, do you work with other members of staff that are not counsellors, or do you just work with other counsellors?
So I guess it depends on whether you mean counsellors or counselling psychologists, but I would say either way, yes, you would work with other helping professionals. So usually working in a multidisciplinary team, a team that has different kind of people from different jobs. So I'm working at an inpatient ward right now, and I work alongside a consultant psychiatrist who prescribes medication and thinks about treatment plans. I also work with a GP. Is it a GP? A doctor, a local doctor. I work with occupational therapists and an assistant psychologist. We're all sat around the table talking about each of the individuals on the ward, and we'll liaise with each other and think about how our approaches to working with this person complement each other. You might find yourself working in an office with a counsellor, a CBT therapist, a systemic therapist, a psychodynamic therapist, an occupational therapist, applied psychologist. So yeah, you'll be, and I think that's great exposure as well. So even as if you're going into an AP job, you might find yourself exposed to a counselling psychologist or a schema therapist or whatnot. So that's really good exposure for learning what you might be interested in. Hope that answers that question.
I can't think of the last job I was in when I was only working with psychologists.
Yeah.
Like even there was one point when I was working in a pure therapy service, and that it was even secondary care. It wasn't even, it was before, it was pre-IAPT, so it was before the NHS talking therapies. So it was a lot of psychology, but even then there was nurse therapists, at least one nurse therapist, and they all had different, and I think, did we have and we had a counsellor actually in that service as well. So I can't remember the last time it was psychology only, and it's it's so useful to be working with other professions. And at one point, a counselling psychology trainee asked me to supervise her supervision, which was fascinating. I loved it, and just finding out how differently we practice. I'm a big fan of counselling psychology. I think if I had my time again and a bit more money, I might have thought about that route instead. But at the time that I was training, it wasn't really very common to do that. I don't think there were that many programs, and certainly the possibilities in the NHS were minuscule compared to now, when it's just exactly the same.
Counselling psychology is a much newer, younger branch of applied psychology. Just one more thing that you'd like to clarify: what makes the counselling psychologist job different to the clinical psychologist job? So very, very, very little. I would just maybe argue that clin psychs might have more exposure to neuropsychological testing, and things like that. And you might work maybe with learning difficulties and certain presentations that counselling psychologists don't work with, and maybe vice versa. You might find that as a counselling psychologist, you're more likely, Lou, please do challenge this if this isn't right. that you're more likely to work in a humanistic or person-centered way, or that might be more encouraged than the clin psych. I don't know if that's really encouraged, the person-centered counselling. I could be very wrong. What do you think?
Well, it's there. So one of the
Mm,
slight differences is that because we don't choose on the clinical psychology doctorate, you don't choose your placement, you're allocated a
mm,
placement. It might well be that your university is interested in neuropsychology, systemic, and CBT, but you might
mm,
actually be working with a humanistic psychotherapist as your supervisor. So
mm,
you may well pick up other ways of working, and I think it's, or whilst it's probably not usual, I do know counselling psychologists that work in learning disability services, so there
mm.
is some
Oh,
overlap.
fab.
Definitely in older adult services, like I said. I think some services would be more difficult if you kept your ethos as a counselling psychologist. I
Mm,
think child and adolescent mental health services tend to be quite diagnostic.
mm-hmm,
Um, and I think it would be more difficult to manage that diagnostic
mm,
kind of feeling with taking a humanist view. I think if you worked in a service where you were doing pure CBT, it would be more difficult because you would be sticking to a structure and a format. So let's say you got employed in a trial, a CBT trial. You wouldn't be able to be pluralistic. You would have to just use CBT by the book,
mm.
and you would get judged on your sessions as to how closely you adhere to the CBT framework. Um, does that answer I'm just going to check what the question was so that I've answered it. Counselling surgery. Yeah. The the oops. I would say also that some other similarities would be, one of the things that clinical psychologists are trained to do is to work indirectly with people as well as directly. So working with at service level to make change using psychological formulation. But I know several counselling psychologists that do that at consultant level now. I don't think it's something that's necessarily trained in the same way, but you accumulate once you've graduated, once you qualify, you accumulate the same experiences that allow you to enable you to be that type of leader. So in that sense as well, there's not really a difference. I've come across lots of senior counselling psychology colleagues who are doing the same kind of work. I think they might do it with a slightly different approach, I think, because one of the things about clinical psychologists is the science rules. Um, I don't think it really does in practice, but in theory, we're driven by the science. So we are supposed to be using evidence-based therapies, and it's more difficult to demonstrate the evidence for a pluralistic approach because it's so individually bound. So that's the downside of it. But of course, as a client, that's not a downside at all. So I think probably between us, we've answered that one, Alicia. You're
It's
welcome.
it's interesting. I think I actually took out a point on one of the previous slides about so I thought it was just too nerdy, but about the idea that, working, even though I'm kind of rubbishing the medical model, there has to be a recognition that if you're going to work in a job like counseling psychology, in in the presence of such a medical model and clinical psychology jobs, you are going to have to engage with the medical model. I have to engage with the medical model on the ward that I'm at, diagnosis thrown at patients everywhere. So I think it's just about engaging with it with a critical hat on. And when I mean critical, I don't mean shit on it. I just mean think about it in terms of in an evaluative, appraising way. So, what's good about it, what's not so good about it. You'll have done that in your essays, but um, yeah, I think it's interesting how the two sit together. But there's lots more similarities and differences nowadays, and increasingly so.
Yeah, I think so. And all things being equal, and there's well, I don't know how strong the movement is, Connor, but there is a movement for counselling psychology to be recognised as an HE funded programme.
Oh
Now,
yeah.
what that'll do is increase the competition for places.
Yes.
Um,
Yes.
but what it'll also do is mean that people like Connor are recognised for the work that they're putting in while they're training, which is one of the
Mm,
things that would, it's not only about having to fund your own placement, it's also about, you are actually part of the workforce, even though you're not counted in the numbers, you are actually providing people with psychological
mm,
help while you're training. So
yeah.
I know it's
Yeah.
a bugbear amongst counselling psychologists, and there is some attempt to address that.
Yeah. Definitely. Okay. So
Yeah.
go on. Sorry.
No, carry on.
So this is for. I just need to check my battery. This is specifically for the University of Manchester programme, and as I said, I definitely encourage you to shop around at different doctorates. But this is the entry requirements. So having a bachelor's degree in psychology with at least a 2-1. I had a 2-1. I got onto the doctorate. Um, okay, what's it saying? You must have one of the following. Oh God, what's this? Masters in psychology or related subject. Oh God, masters in psychology. This is going against completely what I said earlier. Masters in
Yeah.
psychology or related subject, minimum merit or international equivalent. Masters
You
in
must have
psychology.
one of the following. So the
Oh,
bachelor's is
right.
fine. Yeah, yeah,
Oh,
yeah.
got it. Okay, so you would want a master's if you haven't got the
Yeah.
bachelor's. So you
Or
might be
if what you do is achieve a 2-2 and then you get a
that's it.
master's, then you'd be all right.
That's it. Thank you for
Yeah,
that, Bobby.
that's
Big
all right.
question. Um, okay, and then we get to the next one. My computer dies. Professional entry qualifications. So yeah, you'll need basic counselling skills, training, and professional experience of using the skills. So that could be in an applied psychologist job. It could be as a psychological wellbeing practitioner. It could even be in a voluntary role. So it doesn't need to be a paid role. So I think even what I did as a community wellbeing volunteer, where it's a helping relationship, and as a community, as a crisis recovery worker, as a mental health, what do they do? Mental health support worker is a good one. Even just being a support worker is, when I say even just, but yeah, that's great as well. So anything where you have therapeutic experience working with people, and I don't mean you're using a therapeutic approach. You can use a therapeutic approach, but it doesn't have to be. The only thing that they say is that the therapeutic professional experience that you have is needs to be more than a befriending job. So you can't just be in a befriending role, being friends with someone as a volunteer has to have some element of therapeutic relationship, if that makes sense. Um, this criterion, yeah, might be met by the certificate in counselling skills that we've mentioned, or through voluntary experience in a role using counselling skills. I think the certificate would enhance your chances of getting onto the doctorate, but seems like it's not even necessary, actually. It seems like this might have
Mm.
changed. So, yeah, you might develop the skills just through voluntary roles without necessarily needing the counselling skills course, which could save you some money. Um, and you must have BPS graduate for chartered membership, which you will get from the psychology degree you get at this course. Is that right, Lee?
Yeah, yeah.
Cool. Um, okay, what's this? Advice to applicants from the University of Manchester, doctorate in counselling psychology. So when you're making an application, you want 2 references, your degree certificate, evidence that you can speak English at a certain level, personal statement, which is 3,000 words at most, with your, motivations for studying on the course, any experience and skills that you bring to the profession. I think there's a bit more to it as well, and a research proposal of what you'd like to study in counselling psychology. So for that, I would look at what the lecturers on the course researching um, and what theses have been written by previous students and what drawed you and what could you study, what could you research, sorry, that's similar but new and add something to the research base. Evidence of basic counselling skills, as we've discussed. You'll have your chartered membership with the BPS, a graduate basis, just by doing the psychology degree, passport, CV. Criminal checks. Because it's becoming increasingly competitive, they say allow as much time as you can to prepare your application, check out the research pages and the academics profiles. So each of the lecturers will have their own page which shows what their own research is and what they've supervised as a supervisor on the course. Really look at what their interests are, and that will help when it comes to interview as well. You can kind of talk about how you're interested in that as well. Okay, interview requirements. You're interviewed individually and you'll be asked to deliver a presentation of 10 minutes, I think it is. And they tell you what the topic is in advance, and it's not hard at all. It just involves a little bit of research. And some of it I expect would be what we're discussing here today that would be helpful for your own interview. Okay, so this is the University of Manchester specific program description. So A pluralistic approach of therapy is used with a focus on humanistic counselling and cognitive behavioural therapies. So counselling in the first year, CBT in the second year, 450 hours of supervised therapeutic practice. So 450 hours of therapy, and you'll have supervision like once a week or once every other week. And they also they also require that you undertake 40 hours of personal therapy, at least, 20 of which can be counted if they were in like the 3 years before the course. So if you've had 20 hours of personal therapy, up to 20 hours of personal therapy before the course, you can add that, and you only need 20 on the course. The reason for that is that I think it's kind of that practice what you preach thing, learning what it's like to be and experiencing what it's like to be a client, helps us to understand what we like, what we don't like, what helps, what doesn't, and that helps us to inform how we work with people as a psychologist. Yeah, it says here in terms of clinical practice, it can be work within the NHS, private healthcare, and third sector settings like charities, and independent healthcare. I think comes under private healthcare, I guess. I don't know. And we do group analytic module as well, thinking about approaches to therapy that involve analytic groups, like psychoanalytic groups, if you're interested in that. Okay, so that's it from me in terms of the counselling psychology stuff. I feel like we're throwing stuff at you and there's loads of terms and acronyms and whatever. So I don't know if there's any more questions that people have about this, not necessarily just about this course. It can be about counselling psychology more broadly, but it can be about this, and I can try my best to answer it, and Lou can help as well.
And just to say, I don't think we'll carry on with the reflective and supervision parts because there's not enough people here to have a discussion really. So now's the chance to have that conversation with Connor if you would like.
Oh, sorry to interrupt. There should be another.
Oh.
Yeah, the scholarships, because I was asked about this last time. So the University of Manchester also do. God, is it gonna? I need to stop sharing the presentation and share my screen. Hopefully that will take me onto a website. So the University of Manchester offers scholarships. So the first one is the SEED Enhancing Racial Equality Studentship Scholarship. So this would cover you for your tuition fees for the 3.5 years of your program. And in addition, you get, and this is going up for next year as well, 19,000 per year for living costs. So I think that amounts to, like, right now it's like 1,600 a month that you get in your bank, and your tuition fees are paid for on top. So that's fantastic. So this would apply if you're racialized. Just recognizing that access to courses for people who are racialized is not been so easy in the past. And the other one is, I don't know if it's worth clicking on it. More just for anyone really. So the SEED, I clicked on the same one twice. The SEED scholarship, just broadly. Maybe I've clicked the same thing twice. That's fine. Both the 3.5 year scholarships. This is exactly the same. I think there's slight differences in terms of who's eligible for the SERE, the racial enhanced scholarship. I think you can only apply for that if you're, where is it? Academic requirements, you need a 2-1 or above, and a master's degree in a relevant subject. I didn't do a master's, I did 2 postgrad courses, which are like, each of which is half of a master's. So I guess it counts as a master's, but I don't think that's mandatory, to be honest. It's open to home applicants and offer holders who identify as Black and Asian minority, ethnic, or people of color. So I'm not sure that it's eligible, that international students are eligible, I'm afraid, which is such a shame. But I believe that international students are eligible for the non-racialized one. So 2 scholarships. So I just wanted to raise that because free training, and you get money. So maybe you could apply for the course, and if you don't, maybe it's a bit cheeky of me to say, but if you don't get the scholarship, then maybe you don't have to go on the course. But it's just worth considering, highlighting in your application that you'd like to be considered for these scholarships, and then it's a bit easier to get on. Yeah.
Does anyone sort of join the course immediately after graduation from their bachelor's, or do people, because I guess people could do the counselling certificate and get a lot of experience volunteering or doing mental health support work during their degree. Have you known anyone sort of get straight on?
Not personally, but I don't think it's impossible. I wonder if there is something about. No, you're right, because you could get all of that experience during the bachelor's. So it's not impossible. I think it's not impossible. Typically, it might be at least a year between finishing the bachelor's and doing the doctorate, but I don't think it is impossible. So that's why I think, give it a go. And if you get, it's highly likely that if you've got therapeutic experience of at least a year, and as I said, that doesn't have to be legit therapy, then you'll be considered for interviews. So I definitely encourage you guys to look at it. If it really fits with and sits with how you see human beings, how you see therapy being helpful, how it fits with your values and your way of working, then definitely give it a go. But I just do want to acknowledge the financial barriers to this course, hence the scholarships if you get it.
Hey, thanks, Connor. That's been really helpful, as always. I don't, well, in week 12, no one's going to actually want to do the club anyway. So we won't get an opportunity to do the reflection and supervision session, unfortunately, but that's something that I'll make sure is in next year for anyone that's in first and second year that's watching. And unless there are more questions, it just remains for me to say thank you very much to Connor again. And I owe you another coffee or beer or something.
I'll have a bit, thank you.
Yeah.
I'm joking. But thank you very much for having me as always. I love doing these things with you. It's great.
Yeah.
Could I possibly ask a question just before?
Go for it.
This might be a bit crude, but obviously this is like both courses are 3 years of investment. How likely is job security in this field? I just want to
oh God, 100%.
Okay, so like if I did a degree, I would end up with
But I had
something.
and I had a really weird time at one point. When I lived in the Northeast, one of my jobs just basically went because the team that I was in lost money. And I had a choice of the trust could move me sideways, and I said, oh no, I was too proud to do that. Thanks very much. And I started looking around for other jobs, and I was flooded, and I'm not brilliant. So there is a lot of work out there for clinical psychologists. Occasionally there are times when it's more difficult to get jobs, but there is always private practice. So it's quite lucrative, and you're earning a lot more than a counsellor or a CBT therapist in private practice as well. So even if you went on things like Psychology Today or whatever and started looking at what therapists were there, you'd notice that psychological therapists trained, doctor of whatever, will be asking for quite a lot more money. So there is definitely job security. If not in the NHS, then you'll find it in private practice or in non-NHS bodies.
Yeah, thank you.
They're crying out for psychologists, aren't they? So
Yeah.
you'll be absolutely fine getting a job as a psychologist. I thought as soon as I got onto this doctorate, I was like, that kind of uncertainty that you might have before that with all of the AP and PWP and how do I even start all of this? Once you get on, and it's not impossible. When you start the doctorate, you're like, we're fine here.
Mm. Yeah.
Any other questions at all before we leave? And you're more than welcome to contact me as well. I'll put my email in the thing.
Thanks, Connor. That's really helpful. Right. Well, thank you for coming. Thank you for your questions. Thank you for your face, Luke.
Yeah.
And hopefully I'll see you all again. Anyone, Luke, what year are you in?
Oh, I'm second year.
Right. I'll see you next year then as well. Right. Okay, everyone. So I will say goodbye now and I'll stop recording. Okay.